everyone, I'm Dr. Garima Sathi. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic conjunctivitis in English and the demand of few of my patients who are especially non-Hindi. So I'm going to explain about the topic conjunctivitis. It is inflammation of the conjunctiva, that is the white portion of the eye, and along with that there is inflammation of the inner portion of the eyelid too. So this is the inflammation, and signs of inflammations are also present in it. That is redness of the eyes, along with that warmth, hot, swollen area, and along with that some sticky discharge may also occur from it. So viral conjunctivitis especially spreads during summer. Bacterial conjunctivitis especially occurs from December to April, and allergic conjunctivitis especially occurs in spring season. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe my channel, tap the bell icon to get the latest update of the videos, and kindly see the video till the last, because at the last I'm going to explain you about some of the homeopathic medicines which can be helpful in curing this conjunctivitis. So let's continue with the topic conjunctivitis. Now I would like to tell you about the sign and symptoms of the conjunctivitis. So there is continuous watering of the eyes, there is redness in the eyes, as well as there is swelling in the eyes. Sticky discharges may occur or may not occur. It may be sticky or purulent, and it may involve one or both the eyes. Now let's talk about the types of the conjunctivitis. So first and the foremost important and the most common type is viral conjunctivitis. It involves conjunctiva. Along with that, it involves upper respiratory tract infection that may be cold or sore throat. So after this upper respiratory tract infection, if conjunctivitis occurs, then it is especially the viral conjunctivitis. Now the symptoms of this viral conjunctivitis are, there is watery discharges which occurs from the eyes. Along with that, there is sticky discharges too, and the eyes become completely pink. That's why it is also known as viral or pink conjunctivitis. The next variety is the bacterial conjunctivitis, and it is because of the infection of bacteria. It is sudden and too much painful, as bacteria causes purulent discharges everywhere. So the conjunctivitis because of the bacteria is also of purulent variety, and after the infection of the bacteria, it takes 2 to 5 days to show this conjunctivitis. Greenish or yellowish discharges occurs through the eyes, and it is of purulent variety, and there is continuous gritting sensation within the eyes as if some scent has been stuck into the eyes, and there is morning aggravation. Crusting of eyes are also there. So there a pseudo membrane may be formed, a tough membrane may be formed in front of the eyes. This causes this bacterial conjunctivitis. Next variety is allergic conjunctivitis. It is because of some of the allergy which can cause redness, swelling or burning, and it causes increased production of tears from the eyes, and along with that there is also sticky discharges and watery discharges from the eyes. Then the next variety is chemical conjunctivitis. In this, acidic or alkali burns may take place. Alkali burns are more severe than the acidic burn, and both may cause this conjunctivitis, and because of that the cornea become completely white. That is the symptom of this chemical conjunctivitis. Other variety is infantile conjunctivitis. So it is seen in infants and it is self-healing. Now let's talk about the causes of the conjunctivitis. So the viral conjunctivitis is caused by virus like adenovirus, herpes virus or enterovirus. The causes of the bacterial conjunctivitis is Staphylococcus, Streptococcus, Neisseria gonorrhoeae. The cause of the allergic conjunctivitis is allergens that may be pollen or dust or any type of allergic substance. It may be seasonal and other causes may be autoimmune. Along with that, it is a communicable disease, contagious disease which spreads from one person to another. Now let's talk about the diagnosis of this conjunctivitis. So it is a symptoms-based disease which can be seen clinically and it presents clinically especially. Now let's talk about the classification of the conjunctivitis. So blepharoconjunctivitis, it is involvement of eyelids as well as conjunctiva. So both gets inflamed, that is blepharoconjunctivitis. Next is keratoconjunctivitis. So there is inflammation of the conjunctiva along with the inflammation of the cornea, that is keratoconjunctivitis. Next is blepharokeratoconjunctivitis. So it is the inflammation of the cornea, eyelids as well as conjunctiva. So that is blepharokeratoconjunctivitis. Now let's talk about the prevention of this conjunctivitis. So good hygiene and avoid rubbing eyes with the infected hands. Now the treatment of this conjunctivitis. So viral conjunctivitis and bacterial conjunctivitis both don't require any treatment. They are self-healing. But if required, this bacterial conjunctivitis requires antibiotic dose in the allopathic side. But homeopathy can cure this conjunctivitis. So let's talk about the cause of the viral conjunctivitis or the bacterial conjunctivitis homeopathically, as well as the homeopathic cured case and the medicines which can be helpful in curing this conjunctivitis. Now let's talk about the homeopathic cause of this conjunctivitis. So it is a visual separation conflict. For example, parents have gone to any vacation and child is sent to grandparents' home. There is a visual separation conflict, and if he contracts this conjunctivitis, then this becomes the cause of conjunctivitis homeopathically. Now let's talk about one of my cured case from homeopathy. A male patient aged 11 years visited my clinic and suffering from this conjunctivitis. The conjunctiva was completely red, swollen, inflamed. There was too much gritty sensation in the eyes and there was sand-like sensation inside the eyes. It gets ameliorated with the cold water and there was too much hot burning and dryness inside the eyes and the lids were completely swollen. So these were the chief complaints of the patient. He was sensitive to light and was too much fearful. The incidents occurred was in the school, the students were beaten very badly by the teacher and he got frightened because of it. And after that, he suffered from this conjunctivitis. And he was a very restless person and there was also suddenness in the complaints. So on the basis of this, ailments from fear, restlessness and suddenness, Aconite 200 was given and he got completely cured within a week period of time. Now let's talk about the homeopathic medicines which can be helpful in curing this conjunctivitis. So the first medicine is Argentum nitricum. So photophobia is seen in especially warm room. There is intense pain and which gets ameliorated while open air or aggravation in warm room. And there is non-excoriating discharges from the eyes. The lacrimation or the tears are non-excoriating. There is edema of the lids and there is grey spots appears before the eyes. Patient is obstinate, reserved, sad, disappointed and indifferent while in company. He prefers to be alone more. So if these symptoms are present in the patient, then Argentum nitricum can be helpful in curing this conjunctivitis. Next medicine is Euphrasia. So there is sensation of hair before eyes and he wants to wipe it out continuously. There is mucus filled within the eyes. There is discharge of acrid matter always from the eyes and there is running nose along with it. So profuse hot acrid discharge from the eyes. The tears are acrid in it. And there is aversion to answering. Patient does not want to answer. There is always aorta in him. Disinclined to talk. Does not want to talk to anybody. And there is lot of confusion and startling tendency in him. So if these symptoms match with the constitution, then euphrasia can be helpful in curing that conjunctivitis. And the next medicine is silesia. So there is biting sensation inside the eyes. Pustular variety of the conjunctivitis is seen in it, that is the bacterial conjunctivitis. And there is aversion to light, there is sensation of foreign body within the eyes, and can't close eyes because of the soreness and smarting. Then what is the silesia constitution? A good girl image constitution is there, timidity in appearance in the public, and conscientious about trifles, and there is anxiety conscience of patient is too much restless along with it, and there is always a apprehension for getting a good girl image. So along with these symptoms, if the person is having conjunctivitis, that gritting type of sensation inside the eye, sensation of the foreign bodies, then this silesia can be helpful. That's all for today. That's all for this topic. We'll meet soon with a new topic, new subject. The clinic address of mine and the contact number is given in the description link. And kindly don't take any medicine without consulting doctor. It's my humble request to you all. Stay connected to stay healthy. Thanks for watching.